really excited to announce Waillo, which is our AI service layer. We're really proud about the fact that a lot of what we're hearing about AI is about replacing people, right? Like, oh, you don't need sales reps anymore. You can just use our AI and fire your whole team. And that's not at all what the approach that we've taken, because WaitWell is really, whether we're working in government, whether we're working in healthcare, we're really about connecting humans to humans. We're really about that in-person or online service provider from a real person. And so what Waillo is really AI that facilitates that. So on the patient side, what it's doing is allowing the patient to join the line by using real language. So like a patient, for example, could interact with Waillo on your website and say, I have a sore throat, my kid has an earache, rather than selecting from, acute this or, the services as you're describing them. So just using real language and then being able to, rather than having to navigate to a website and choose this location or that location, saying, I live in Calgary on the West End, and find me the nearest clinic that can get my kid in because he's got a sore ear. So using real language to get connected to the service provider that's, closest, nearest, most relevant. So that's one side of it. And then the other side that I get really excited about as a previous business owner who used WaitWell myself is the insights. So Waillo Insights actually uses real language and delivers, it basically acts as an analyst. So let's say you're running a healthcare organization that has, 150 locations, and you know that there's a no-show problem, and that's affecting the throughput, the number of patients that you're able to see. You can ask Waillo, how do I reduce my no-show rates? Or which locations have the biggest problem with wait times, and how can I address that? And it'll give you recommendations based on all of the data that it's collected over time for your usage for your multiple locations.